Hi, everybody. I hope everybody is surviving this COVID-19 pandemic. It's pretty bad. I mean, they've closed all the gyms down. I haven't been able to go to the gym, and it's been a couple of weeks now, I guess. They were optimistically talking about the gyms opening April 1st, but of course they didn't. That was based on the number of COVID-19 cases going down, and instead they went up. So it'd be lucky if the gyms open by June, maybe even later. So that requires people to maybe start working out at home. I want to talk about something at the end of the video. I want to talk about some of the things I've done. I already did a video about working out at home. I just want to give a progress report and some warnings about what's going on online in regard to exercise equipment, because there's a lot of crooks and scumbags who are taking advantage of the situation by grossly overpricing exercise equipment. I'm going to tell you some things to look out for that I've experienced. I was even suckered into buying a set of exercise resistance bands, they're called, grossly overpriced. I bought them because I don't know much about these things. I've never actually worked. I've always lifted weights. I've never used resistance bands. I watched a couple of videos by this one particular guy. I should have realized that he owns the company. He's always pushing this stuff. But he sells, he sold me like 5 bands. Cost me $127. But I'll get into the details. I will say it's a gross ripoff. Don't buy the bands from this guy. You probably think he's a great guy because he's putting those videos on. Let me tell you something. This guy's a scumbag too, and I'll tell you why at the end of the video. Right now, though, the main topic I want to talk about here is food supplements in relation to COVID-19. I thought I should make this video because there's a lot of myths going on about how taking certain vitamins or nutrients can either block the COVID-19 virus or cure it. Now, I want to tell you right from the onset, there's no supplement, diet, or other lifestyle modification other than social distancing and proper hygiene, like washing your hands a lot. You should always wash your hands every time you come off the street. You don't know what you touched. Some of the studies coming out now show the COVID, it's actually called the SARS-CoV-2. That's the actual name of the virus. It can last on surfaces a surprisingly long time, like 22 hours, and in some case like 9 days. So even though you might be wearing masks and all that stuff and gloves, you could touch some of these surfaces, and if you touch your face, you can get the COVID-19 disease, and you have to be real careful of that. So you always want to, and by the way, people who are wearing the gloves, the thin rubber gloves, they're only good for one use. I don't know if you realize that. The people are, these things get the virus on them too, and people are using them over and over again. I mean, the virus can last on these gloves for days. So they're taking off the gloves. They're touching their hands on the gloves. They might touch their face. So they think they're protected because they're wearing face masks and gloves. But by touching the gloves, taking them off and reusing them, then touching their face, they're giving themselves a disease. They're only good for one use. The same with the surgical masks. They're good for one use. You throw them away after that. If you keep reusing them, they're garbage. And if the mask doesn't fit tightly around your nose and your mouth, if it has like openings or it's loose, it's not doing you any good at all. The virus can get right underneath and get into your body. By the way, the virus can also enter through the eyes. So in other words, if you're in the proximity of somebody who sneezes or coughs and they have the disease and they're closer than 6 feet away, even though you have the mask on, if your eyes are not covered or wearing glasses or something, that virus is going to get into your body right through your eyes. So, don't get into any false sense of safety. But so I just want to get that right off the bat, that don't fall into the trap of believing that there's supplements that are going to prevent or cure. But that requires a caveat. What you can do is build up your immune system, because, and this is what they know, the stronger your immune system is, the greater the chance of surviving. The people who have had the mildest cases, in other words, the people that have been infected with this virus, who they've had symptoms, fever, weakness, tiredness, muscle pains, almost like a bad flu, but they survive. Those people have one thing in common. They all have very strong immune systems to begin with. And the immune systems are able to get them through the disease So what these nutrients can do, this is my point, what these nutrients can do is increase the strength of your natural innate immunity, where, God forbid, if you do contract this virus, you have a much, much greater chance of survival. But don't think that any of these nutrients will kill you. There's one exception, which I'll get into, that might actually help to cure disease, but there's not enough evidence. I'll talk about that in a minute. But let's get into some of the specific nutrients. Vitamin D. Vitamin D has been shown in several studies to lessen the severity of a flu, which the influenza, as most of you know, is also a virus. It's not the same virus as the SARS-CoV-2 virus that's causing this COVID-19 problem. But, the vitamin D works by increasing the strength and the power of various immune cells, such as monocytes and macrophages. Vitamin D is also needed to activate killer T cells. Now, killer T cells are immune cells that actually attack and destroy viruses. Now, eventually they're going to come out with a vaccine that's going to will be kind of like it'll activate your immune cells, some of these same immune cells. So if you ever encounter the coronavirus, these immune proteins that I'm talking about, these immune cells, macrophages, monocytes, and all that, and T cells, they'll be able to attack the virus immediately, where you won't get sick at all. That's the goal of the vaccines. Anyway, vitamin D is associated with, as I said, low vitamin D levels of D are associated with increased risk of any type of respiratory infection. And COVID-19 works. I'm sorry, the SARS-CoV-2 virus works by getting into your respiratory tract. First, your trachea kind of takes hold. It works through something called the angiotensin converting enzyme. That's how it gets into that's how it starts the infection. As a matter of fact, let me say as an aside here, a study in China showed that Chinese people that were already infected with this COVID-19 thing, they showed uniformly low levels of potassium. And the reason that they show low levels of potassium is because when you inactivate the angiotensin converting enzyme, in other words, the virus gets in the body, inactivates this particular enzyme, and when you do inactivate that enzyme, your body loses potassium very fast. So these people, and what happens there? When the potassium gets low enough, you have something called hypokalemia, and that can cause heart rhythm disturbances, which explains why a lot of the people that have COVID-19 have heart rhythm disturbances. What does this mean for you? Well, if you're eating enough potassium-rich foods like fruits and all that, vegetables, bananas, potatoes, that kind of thing, you're covered already. But it should be known, and you might want to pass this on. Somebody who, if you know anybody who already has this COVID-19, you might want to advise them to take in at least 3 grams a day of potassium, because it'll protect their heart. If they don't, because their body will be losing potassium like crazy by having this virus in the body. So you might want to pass that on. But getting back to vitamin D, as I said, it seems to have a definite preventive effect against influenza and also allergic asthma. I have asthma. When I started taking vitamin D years ago, full disclosure, I do take asthma medications. However, the asthma medications didn't always work as well as expected. But when I started taking vitamin D in appreciable amounts to bring my vitamin D blood level, what they call 25-hydroxy cholecalciferol, that's the activated form of D. When I got it up to levels about 50 to 65, I have not had any wheezing or breathing problems since then. I believe the vitamin D has helped me. So my point is, vitamin D is very good protection against respiratory tract infections, and this is a respiratory tract infection. A January 2019 review of randomized controlled studies involving 11,321 people who supplemented with vitamin D showed that it significantly decreased the risk of respiratory infections in people deficient in this vitamin and lowered infection risk in those with adequate vitamin D levels. Now, I'd say, if you say to me, how much should I take? I'd say about 2,000 units a day is a good supplemental dose. That'll bring your vitamin D levels up to optimal, which is, again, between about anywhere from 50 to 65 of the 25-hydroxycholecalciferol. That's the lab test that's activated vitamin D. You always want to take vitamin D with a meal containing fat because it's a fat-soluble vitamin. When you take vitamin D with a meal containing fat, it increases the uptake of vitamin D by at least 67%. Like I say, vitamin D, I've said this in past videos, it comes in the preferred forms vitamin D3. The only time I've seen vitamin D2 is in some cheap vitamin minerals. That's D2 is the completely synthetic form. It's actually made from sheep wool. I mean, it'll raise your vitamin D level, but it's not retained in the body as long as the more natural D3 form. So always get vitamin D3. It's very inexpensive. The capsules are tiny. They're very small. A baby can take these, so they're not what they call horse pills. They're easy to take. And that next nutrient I wanted to is also getting a lot of publicity in relation to this COVID-19, and that's the trace mineral zinc. Zinc is very essential for immune function, but it has what they call, in medicine, there's an expression called hormesis. And what that means is a small amount of anything could be very beneficial to you, but once you get past a certain point, the same substance that's beneficial to you starts to turn toxic. They call that a U-shaped curve, and zinc falls into that category. It's like working out. If you work out properly with enough intensity, enough rest, enough sleep, enough protein, you grow. If you start to overtrain and do 100 sets or some crazy routine, you're going to lose muscle. That's also hormesis. But zinc also has an hormesis effect in that an adequate amount of zinc actually stimulates immune function and all these immune cells that I talked about. But if you take too much, it has a reverse effect. It starts to dampen immunity. What is too much? Too much, I would say, is anything over 60 milligrams a day of zinc. 100 milligrams a day, it's been shown to lower protective HDL levels. That's high-density lipoprotein, helps protect you against cardiovascular disease. Right now, there's a trend, or there's a fad. A lot of people are taking zinc lozenges. I tried to buy some. Good luck if you could find them, because they're sold out everywhere. They're sold out on all the online supplement sites. They're sold out in stores, because the stuff online, again, here we go with this internet bullshit. People are writing online that if you take zinc lozenges, you never chew them. You let them kind of dissolve in your mouth. They kind of get in the throat, and again, as I said earlier, that's where the virus first takes hold, in the throat. That's why they tell you to drink a lot of water, because you always want to keep it moist. If you do have the virus, let's say somehow you get in a situation where you get the virus in there, literally, if you drink water, you could actually flush it down into your stomach, where it'll just be destroyed by the stomach acid. But the theory about zinc lozenges is that zinc is known to inactivate viruses. So, in other words, if you take the zinc lozenges, they more or less coat your throat. So, if you are exposed to, the SARS-CoV-2 virus, it'll inactivate it completely. Now, it makes sense from a certain standpoint. The problem is we don't know this is true. There's no evidence that zinc lozenges will actually deactivate the SARS-CoV-2 virus. There's no evidence whatsoever. It won't hurt you, but like I say, good luck trying to find them, because then thanks to all the internet bullshit, they've been zinc lozenges are sold out just about everywhere. Now, zinc deficiency does affect 2 billion people. 2 billion people are deficient in zinc worldwide. It's very common in old adults. In fact, 30% of older adults are considered deficient in this nutrient. 30%. Now, one thing to consider, where are the majority of cases of COVID-19 occurring? Older people. And I'm not saying it's because they're deficient in zinc. What I'm saying is being deficient in zinc adds to the problem, because zinc is needed for your immune system to work. And a little known fact, the flu shot, for example, take the flu vaccine, it works with your immune system. And a lot of older people, they get flu shots and it doesn't do anything for them, offers no protection. Why? Because the immune system in a lot of older people is so it's so downgraded, it's almost like an AIDS patient, it's like not working. And the flu vaccine works by, again, working with the immune system. And if the immune system's not working, the flu shot's useless. Even for healthy people, it's only 60% effective, which to me is better than nothing, but that's the way it works. Supplemental zinc reduces the severity of upper respiratory infections, including colds. That's the original purpose of zinc lozenges. They would supposedly help to prevent colds. Excess zinc, like I say, can not only can it lower HDL, but it also interferes with the uptake and absorption of another trace mineral called copper. Copper is needed, among other things, for the integrity of connective tissue. It's needed to form collagen, and in extreme cases, with a collagen deficiency, the aorta, which is the great vein leading out of your heart, it actually starts to break down when you have a copper deficiency. But the truth of the matter is most people get too much copper rather than too little. But, certain people like vegans have to be a little bit more aware of their copper intake. Copper's like meat is loaded with copper. If you eat meat and that kind of stuff, you don't have to really worry about copper. But I say don't go overboard on the zinc. Vitamin C, that's the next one. Vitamin C. Some studies emerging again out of China. That's, of course, where this COVID-19 disease first emerged in Wuhan, China. There's some studies that have been released out of China showing that doctors there gave people who were shown to have the COVID-19 virus disease, they gave them intravenous large doses of vitamin C. Minimal dose was 10,000 all the way up past 20,000 milligrams. You cannot take that much orally. If you do, you're going to just get diarrhea, you're going to crap it out, you're going to piss it out. It's not going to work. You can't take massive doses of oral vitamin C to prevent this virus. Whether the intravenous vitamin C, supposedly the Chinese patients that got the intravenous C, none of them died. None, not one. I think there was something like 500 patients involved. Not a single one of them died. Now that is, again, that's anecdotal though. This information has not yet been published to my knowledge. It may or may not be true. However, vitamin C, it is known to kill viruses, so, but again, it would have to be in intravenous form. And I'm in no way saying that you should run out and have intravenous vitamin C, because again, there's no real evidence at this point other than the Chinese saying this, that it will knock out the COVID-19. But it's interesting to think about. A very famous scientist, the guy referred to as the father of organic chemistry, two-time Nobel Prize winner, Linus Pauling, was saying, 40 years ago, he wrote a book called Vitamin C and the Common Cold, I believe it was called. He was touting the effect of vitamin C against viruses, in particular rhinoviruses, which cause the common cold. He was saying that it deactivates it 40 years ago. I'm sure if he was still alive today, he died at age 94 of prostate cancer years ago. But if Dr. Pauling was still alive today, I have no doubt he'd be pushing intravenous vitamin C to treat this coronavirus situation. But it's good to take vitamin C anyway, because, like I say, it does favorably affect immune function, and who knows, it might help you. It does seem to have a little bit of effect on the common cold, although some studies say it doesn't. I know that what I believe it does is if you take vitamin C at the onset of a common cold, which again is also a virus, it won't cure the cold, but it'll definitely shorten the duration and the symptoms, like the sneezing, the runny nose, and the crappy feeling. It shortens the duration from, let's say, instead of having it for 8 days, now you have it only for 4 or 5 days. So, I think it does have an effect on viruses. So it's good to make sure you take about vitamin C. I would say to take at least 1,000 milligrams a day. At least. You can take more than that. If you take past a certain amount, like I say, it's going to give you diarrhea. That's called bowel tolerance. Some people can take more vitamin C than others. If you have trouble with vitamin C, like upset stomach, take a buffered form. There's like ester C. It's basically vitamin C with calcium, which buffers, because vitamin C is actually an acid. It's ascorbic acid. And some people, the acid, when they take large amounts, it kind of like upsets their stomach. So in that case, you take the ester C, which again, it's buffered. In other words, it kind of neutralizes the acid effect without affecting the potency of the C. Another supplement thought to help with viruses, particularly flu virus, but it's been recommended online by some people to use to treat this COVID-19 situation. Elderberry. Elderberry has shown a pretty good record against flu viruses, in the sense that if you know you're infected with the flu virus, if you take elderberry right away, just like vitamin C will shorten the duration of a cold, elderberry will definitely shorten the duration of the flu from, and like I say, anywhere from 8 to 10 days down to maybe 5 days. It'll make you feel a lot better. An older 5-day study from 2004 demonstrated that people with the flu who supplemented with a tablespoon or 15 milliliters of elderberry syrup 4 times a day experienced symptom relief 4 days earlier than those who didn't take the syrup, and were also less reliant on flu medication like Tamiflu and some of them. They didn't have to take that stuff as much. When you want to always try and minimize the use of these kind of drugs. They all have side effects. A drug without side effect is a drug that doesn't work, period. That includes any drug. A review of 4 randomized controlled studies in 180 people found that elderberry supplements significantly reduced upper respiratory symptoms caused by viral infections. Again, will it work against the COVID-19 disease? No evidence yet, but again, it's natural. It won't hurt. Okay, let's move on to another one. Is medicinal mushrooms. I'm a kind of a believer in that. I'm going to do an article in my Applied Metabolics newsletter about some of the features. The late popular trainer Charles Poliquin was a huge believer in medicinal mushrooms. He used to recommend it to his athletes all the time. I was skeptical years ago, but after doing some research and taking a couple of these things myself, I'm a kind of a believer in the effects of some of these so-called medicinal mushrooms. I use one regularly called lion's mane, which I talked about in another video. It's basically a cognitive enhancing mushroom. If you take it, it increases something called nerve growth factor. If you take it for it takes about a month to really kick in, but you'll notice you have greater memory, greater focus, and greater concentration. It really does work. There's no doubt in my mind. Some of the other medicinal mushrooms are cordyceps, maitake, shiitake, reishi, and turkey tail. Turkey tail is a particular stimulant of the immune system. All of them have been shown to benefit immune function. So, that's another consideration. Again, I'm going to keep saying this. Does it help COVID-19? No evidence for that yet. But again, the mechanisms indicate that it might help in some slight manner, you know what I mean? But there's no hard evidence. Astragalus is it's an herb used in traditional Chinese medicine. Animal research suggests that its extract may significantly improve immune-related responses. So that's another thing that you could possibly look into. The trace mineral selenium it's a trace mineral that's essential for immune health. Animal research demonstrates that selenium supplements may enhance antivirus defense against influenza strains, including H1N1, which was a big strain going around a couple of years ago. Again, it seems to help with influenza. I don't know if it'll help with the COVID-19. Garlic is that's a killer of bacteria and viruses. They hate garlic. It also keeps vampires away too, in case you ever run into one. I don't know if it works on zombies, but there seems to be a lot of zombies walking around among us. You can tell who the zombies are. They're the ones that hoard toilet paper for no particular reason. Those are definite zombies. But anyway, garlic has powerful anti-inflammatory and antiviral properties. It's been shown to enhance immune health by stimulating protective white blood cells like natural killer cells and macrophages. But the research on humans is kind of limited, So, in World War I, they didn't have a lot of antibiotics handy, so they treated a lot of soldiers who had infections with garlic, and it saved God who knows how many soldiers' lives. So there is something to garlic. One of the active ingredients called allicin. That's a whole nother video. But anyway, it's still another natural substance that's being touted to work to help with COVID-19 is curcumin. Curcumin is the main active compound in turmeric. People in India have been, eating turmeric found in curry for many years. There's curcumin. Some studies have shown curcumin helps to clear out certain proteins in the brain, like beta amyloid and tau, that are considered to be responsible for Alzheimer's disease. And you might say, well, that sounds pretty anecdotal to me, but maybe it's coincidental. But India, because the people regularly eat curry, which is, again, rich in turmeric, which is, again, has curcumin. And the way they make it, they kind of use oil, and they cook it with oil. The oil increases the absorption of the curcumin. To make a long story long, India has among the lowest cases of Alzheimer's in the world. It's something like 1 or 2% of the population. They think it might be because of the curry ingestion. I don't think anyone's ever proven that, but what can I say? But anyway, it's been, again, animal studies indicate that curcumin might improve immune function. One study that was published only online, found that curcumin was able to inhibit the virus that causes COVID-19. That's the SARS. It's the SARS-CoV-2 virus. That's the name of it. It was actually shown to directly inhibit that virus. Animal studies show that curcumin appears to protect the lungs from the damage related, to some of the to viruses, I should say. Again, those studies unfortunately involved injecting curcumin. It was injected, and that's a problem with curcumin because it's very hard to absorb. Very hard to absorb. They do sell supplemental forms that involve, how can I put this, kind of a Trojan horse effect, where they envelop curcumin in stuff like lipid layers and stuff like that, which causes the curcumin to be absorbed much greater. Another possible way is to combine it with a black pepper substance called piperine. That increases the absorption of curcumin by 2,000%. Most of your standard curcumin, though, without these substances, will have very, very little oral absorption, won't do anything. And again, the studies that showed that curcumin directly inhibited the virus that causes COVID-19, that was injected in the body, injected. Just want to make that clear. Echinacea has been long used as an herb. It's been long used to treat colds. It's part of the daisy family. Certain species have been shown to improve immune health and may have antiviral effects against several respiratory viruses, including respiratory syncytial virus and rhinoviruses, which of course cause the common cold. One interesting thing about echinacea is that it can also increase erythrocyte production, red blood cells, which makes it work almost like EPO, which athletes use to increase red blood cell production, which delivers more oxygen to cells. Echinacea might do that also. There's N-acetylcysteine is a antioxidant. It's one of the best nutritional precursors for the endogenous antioxidant in the body called glutathione. But NAC also has been shown to inhibit the flu virus. Same deal. If you have the flu and you take NAC in the early stages, it's going to lessen the severity and the symptoms of the flu. Will it do that for the COVID-19? Again, no studies, but who knows? Maybe it will. I'm just trying to be complete here and tell you what I found here. Some people are recommending coconut oil because coconut oil can inhibit some viruses because of certain fatty acid compounds contain the oil, such as lauric acid and a byproduct of lauric acid called monolaurin. But there's no evidence that coconut oil offers any preventive effects against COVID-19. Another nutrient that's really interesting is called quercetin. Quercetin is found in, where is it found? It's found in vegetables and fruits and various other foods. But there's one form called isoquercetin. It's available in supplement form, in a supplement form called EMIQ. And it has 40 times greater absorption because quercetin is another nutrient that's, again, hard to absorb orally. But this isoquercetin form, or called EMIQ, that actually has 40 times greater absorption than straight quercetin. Some animal studies show that this particular form of quercetin actually stimulates muscle growth also. But in lab studies, it's been shown to inhibit a wide range of viruses, including the SARS-CoV-2, the same virus that causes COVID-19. Studies of mice that were first injected with isoquercetin, then infected with a lethal dose of the Ebola virus, showed that mice that received the injection all survived, but those that didn't all died. Quercetin appears to work by preventing viruses from entering cells or increasing the viral load of cells. So it's interesting, this isoquercetin stuff. They're actually studying it right now because of the way it actually was shown to directly inhibit the same virus that causes COVID-19. They're looking at it now. They're testing it to see whether it can actually be used as a medicine to help treat COVID-19. But right now, it's up in the air. We don't know. I mean, you don't know if it's going to help or not. But this is more like test tube studies. a lot of things that work in test tubes or in vitro don't translate into the human body physiology, unfortunately. Just today I saw one, there's a report that a certain type of medication that's used to treat parasites also in a test tube completely destroyed the virus that causes COVID-19. I mean, on contact, it destroyed 99% of the virus. Does it work in humans? I don't know. Nobody's done any human testing on it, but it's something they're also looking at. I mean, these things are all in the fast track because of this horrible pandemic that's killing people. Items that don't help include gargling with apple cider vinegar. Some people are recommending that. All that will do is burn your throat. It causes kind of burns in the throat. CBD oil is good for a lot of things, but not good for COVID-19. In fact, CBD oil has a reverse effect. It actually can dampen immune response. That's the last thing you want in trying to prevent COVID-19, dampen immune response. The whole purpose of these nutrients is to increase immune response. Something called Miracle Mineral Solution. It contains sodium chloride, which can turn into bleach. Forget that. And another one being touted by certain jerk-off evangelists, colloidal silver. They're trying to say that that also cures or prevents COVID-19. The only thing that colloidal silver is going to do is if you take too much, you get a situation where your skin turns blue. So, the only benefit you'll get out of it is you could possibly start your own Blue Man group. That's about it. So those are the main nutrients that are being touted. And again, to sum it all up, none of these things have been shown to prevent or certainly cure COVID-19, but there's pretty good evidence that a lot of them, the ones I discussed, will increase your immune response. So God forbid if you do get this particular disease, you have a much, much greater chance of living because your chances of survival depend on how strong your immune system is. If your immune system is weak, and again, this is why older people are dying because of weaker immune systems. That's why the preponderance of deaths from COVID-19 are in older people because they have weaker immune systems. Anything you can do to strengthen your immune system is going to increase your chances of survival. But what you want to do right now, as I said in another video, is really try and avoid people. You should wear, I think everybody should start wearing those masks, and you make sure that it's tight enough around your nose and your mouth that, you don't want it loose because the virus can get right underneath and get into your nostrils, and it's not going to do you any good. And if you're going in public, I know it looks funny, but wear some sunglasses or something. Because if one of these people who have the disease, 25% of people who are already infected are walking around now. They're not showing any signs of the infection. These people are walking petri dishes that they're spreading the disease without even knowing it. And a lot of these people aren't wearing masks. If they cough or sneeze or even breathe in your direction and you're within 6 feet, it's just like inoculating you with an injection. You're going to get it. So you want to be really careful. I don't care if it looks antisocial. Don't let anyone get within 6 feet of you. Anybody. I'm talking anybody. So that's about it for this thing. But as I said earlier, and this video is on a little long side, but I think this information is important. I also wanted to talk about, in a past video, I talked about training at home, what you could do to stay in shape during this pandemic, and I mentioned a couple options. I wanted to give an update. I sent for some, I didn't have any weights. I tried to buy weights. A lot of you probably experienced the same things I have. The people of these sharks are grossly overpricing it online. They're selling sets of dumbbells that normally would sell for maybe, $50. They're selling it for $1,500, $2,000. Forget it. I'm not going to buy that. They're worse than hoarders. They're disgusting people to do that. They're taking advantage. Luckily, a friend of mine, David Young, I want to publicly thank him. He saw my plea about how I had no weights to lift. He brought me a couple of old weights to use, so I have about 70 pounds here. I have some adjustable dumbbells, a barbell, a little rusty old barbell, but it works. So I've already started working out a little bit. But before he came over, I didn't know what to do, so I sent for what they call resistance bands. I had watched some videos online of a guy who really pushes the hell out of this. This guy's got I'm not going to mention his name, but you guys will probably know what I'm talking about. This guy has a whole bunch of instructional videos on how to use the resistance bands. And he always uses the same kind. They're orange-colored bands. And it turns out that he sells those bands, right? So I didn't know anything about it, so I bought his brand without this is an example of why you always have to research before you buy something. I didn't research it. I was desperate to work out. My muscles were already atrophying. I needed to do something fast. So, I went to his website. He had some of these bands on. However, here's what I found out. He sells you 5 bands. The total cost was $127, believe it or not. Now, things I got to tell you, unless he doesn't sell them with it, you have to get these bands. If you're going to buy them, make sure they come with what they call a door anchor. This is this thing where you attach to a door. You could wrap the bands around the anchor. You could do a lot of different exercises that simulate weight training, simulate pulley exercises. But without the door anchor, you're very limited, and you're very limited in what you can do with these bands. He sells these 5 bands for $127 without even giving you a door anchor. There's no instructions on how to use them. For that, you have to buy his workout routines. This guy is a real scumbag, I think. I mean, to charge people $127 for 5 fucking bands that has no door anchor, so you can't do half the exercises, and then he makes you pay to learn how to use them. What a piece of crap this guy is. So don't buy any so-called resistant bands. Don't buy them unless they come with what they call a door anchor, because about at least, I'd say more than 60 or 70% of the exercises, you need to have a door anchor to do them properly. Don't buy them. Don't be ripped off like I was. This guy's a scumbag to sell. I even wrote them a note. I said, how could you sell these things without a door anchor? What a rip-off deal that is. Terrible. Anyway, but that's what I wanted to say. I sent today I sent for another type of bands that these have handles on them. They do come with with the anchors. They're gonna probably be a lot more useful to me than the bands I sent for. I'm still trying to figure out how to use these things. So be real careful. There's an ad circulating on Facebook where somebody is supposedly selling Bowflex dumbbells that go up to they're adjustable dumbbells. They go up to 52 pounds. They're selling them for $89, shipping free. Don't buy them. Don't be suckered. It's a fraud. They're not selling the dumbbells. Those dumbbells list for $300, and nobody's going to send you 100 pounds of dumbbells with free shipping. Nobody's going to do it. That's your tip-off right there. They work under about 50 different company names. They're putting ads all over Facebook. You'll know it because they show a picture of the Bowflex dumbbells. It says $89, free shipping. You're not going to get any dumbbells. They're not going to send it. I guarantee you they're a fraud. I don't know where they are. They're somewhere in Europe. Who knows? The thing is, what they're doing is they're harvesting credit cards, because when you buy it, you're giving them your credit card number, your authorization code, and your date of expiration. Anybody can use your card. I actually was suckered into that myself. Again, I didn't read it carefully. I was desperate. I sent for the dumbbells. I already disputed the charge. I had to cut off my credit card, because what they're doing is they're harvesting credit cards to sell. So, if you're dumb enough, like I was, to buy these things, and you don't do anything, don't be surprised if you start getting credit card. They'll destroy they'll empty your bank account. These scumbags. I think people like that should be taken out and shot dead. If there was no law, I would do it myself. I would love to kill these people. And I'm not homicidal, but these are the lowest of the low. To take advantage of people in a situation like that, these are psychos. So that's my rant. If you want to have the best information on nutrition, exercise science, ergogenic aids, anti-aging research you can use today, hormonal therapy, food supplements, which ones work, which ones don't, women's health and fitness. What else did I say? All these topics are covered in extreme depth in my Applied Metabolics newsletter, www.appliedmetabolics.com. It's 40 to 50 pages every month. It's like getting a e-book every month. And there's no ads. I'm not unlike these scumbags who put out videos. Like you can say I'm advertising when I'm saying this, because I'm pushing my newsletter here. But that's all I'm doing. In my newsletter, I'm not trying to sell you anything. There's no ads. I'm not mentioning any company names. My newsletter is educational, and you will get something out of it, unlike these freaking bands that I bought, which I'm probably going to use. I don't know, maybe I'll use them in my car or something like that. They seem to be just a complete waste. But anyway, so subscribe today, www.appliedmetabolics.com. When you do subscribe, I'll send you an invitation to join my private Applied Metabolics Facebook page, where each month, every day, I put new data or new studies on exercise, nutrition, fitness, and general health. And also, I have an email portal on my Applied Metabolics site, which is exclusive only for subscribers who could send me short questions related to anything in the newsletter or any short questions they want to ask me. I'll ask them if you're a current subscriber. I don't answer unsolicited questions. You're welcome to leave comments under this video. If you get really nasty, I'm probably going to delete it though, because I don't like to look at nasty comments. I'm giving you free information. You give me a fucking break. What, are you going to attack me for that? Come on. I mean, you got to be another scumbag to do that, to get, these little trolls that leave nasty comments. I mean, it really doesn't bother me. I just don't like look at them, so I'm going to delete them if I see them. So don't waste your time. I appreciate nice remarks, though, and also, constructive criticism is fine. That's fine. And also, if you want to leave ideas for future videos, I'm open to that too. So that's about it. This is, I think, the longest video I've done in about 2 years. But anyway, take care.